Well, a better way to start off the show this morning, a great song there from Timmy Dakolo. And looking at what has been happening in the country this morning, we will be looking at the Ebola, the EVD, the Ebola virus disease, drawing up some kind of awareness and see how proactive some other states that have not recorded any, case of this EVD are taking to see that it doesn't get to them, and see how much of assistance they are also giving to other states that have such experience. We'll have Dr. W.H.O. He is the Commissioner for Health at Imo State, joining us this morning. Good morning, and thanks for joining us.
Good morning. Good morning, viewers.
And also we have Dr. Daya Adeyanju. He's the Commissioner for Health in Ondo State. He too is right here with us in the studios. Good to have you here.
Well, thank you so much.
Well, let's start with your state, even though it's also a border town between some southwest state and some other south state like Edo State. You don't have a case of EVD in your state?
No, we don't have at the moment.
Are you worried?
No, we don't pray to have one, though.
No, are you worried?
Yeah, of course. I mean, if I pretend not to be worried, I'll be deceiving myself, because since we have in other states, then one has to be ready. Like the Boy Scout we say, that you should always be ready, and you don't want it to catch you unawares, and so that's why one needs to be worried and be putting all the machinery in action to ensure that you never have an outbreak.
When you say, we should be ready, have you put in any? What have you put in place to see that this readiness is watertight?
Well, thank you so much. The first thing is that, of course, when the thing came in and we had initially, we embarked on light sensitization, not at that time, not to create panic of any outbreak. But when eventually the index case came in, of course, we then became very aggressive in terms of our sensitization. And the first batch of people we had to sensitize were the health workers, because they are the most ones that are greatly hit by this. And even when you look at the statistics of the number of deaths, as we're speaking today, most of them have been the health workers. So we had this sensitization for them, and they need to really understand how the flow is going to be, even the reporting pattern, the surveillance officers in partnership with the general practitioner, because you look at the public facility, the private facility, and then look at in partnership with the partners, development partners. We had that sensitization, and then we had to again embark on sensitization to traditional rulers, to religious leaders. And then again, for our own case, Ondo State has the longest coastal line. Mm-hmm. So we had to go embark on the border sensitization, because people can get sneaking around that area. So although these are aggressive sensitization, of course, the TV programs, the jingles, the radio jingles, the TV jingles, all of those ones were going on. Then we embarked on bulk SMS to all the adult population, and all of them to be careful. But as we speak today, we have to again go on to look at other pocket people that we know can be, particularly during that time when there was doctor strike. People will be going into the patent medicine vendors, and then all of that. Then we have to look at that again. And in fact, the beauty of what we have done is that the governor has led this sensitization himself. He's gone to churches, he's gone to other areas. Each time he has to speak in public, always end with Ebola.
We'll come back to you since you have actually gone into what His Excellency is doing that. But Dr. Hejirika, Imo State is almost very close to River State, and there's a cases now of the EVD in River State. That should give you some cause to worry.
Yeah, well, we've been really concerned since the case came into River State. You know the history of how that happened, But most importantly, our biggest strength have been our people, because of mass sensitization, which we started even before the index case came into Nigeria. And what that has done is an excellent feedback mechanism coming out from the communities back to us in the center, because we do have Ebola helplines. My number is one of those numbers that we put out there in the public. And what that has done is that everybody who comes into the state with an illness that is not properly understood, people usually calling to tell us, listen, there's something going on here, and you must respond. And so we have tried to respond to every case, no matter how it is, a rumor, whatever people have said they hear, we've tried to respond. We've sent in our disease surveillance and notification officers, and we actually do reports on those suspected rumors, and report back to the WHO coordinator within the state. So, of course, what we've done also is to ensure that some of the programs that the state has been hosting, especially recently we hosted the Nigerian Bar Association conference. We've hosted a workshop for for nurses, nurses training. We've also hosted the Nutrition Society of Nigeria very recently. So Imo State now receives a lot of people who come into the state, and we try as much as possible to make sure that we screen people as they come into the state.
Let me bring you to the sensitization messages and programs that you have organized. I must commend Ondo State.
Thank you.
I was going to ask you, how have you gone about your sensitization, and you've broken it down. I think it's commendable.
Thank you.
But, should there be a unified sensitization program, or you have broken it down into ages, classes, so it is very understandable? Because one of the challenges of this Ebola virus disease is that we also don't know that much about the disease yet. So we must be able to break it down for each person. Imo State obviously has, probably you look at languages, you look at the people, you look at class. Are you looking at...
Yeah, thank you. That's very critical, and that's what I realize. The more you get to know more about this virus, the more you understand the strategy to put in place. Of course, we broke down to the 3 languages that they speak in Ondo State. We had the Iberi language, the Yoruba language, we did Pidgin and English. But beyond that, what we have done again, because each class of people have their role to play. When you're talking to traditional rulers, particularly if you're talking to the Muslim cleric, their own role has to do with the fact that, Muslims are quick to bury people without having to find out the cause of death.
Absolutely.
So you need to let them realize that before you rush to bury a dead body, they need to know what is the cause of this death. Hope it's not going to be Ebola virus, the Ebola disease. And if it is, then the way you're going to handle it is going to be different. And then you're talking to them about cremation, So, this is not something that is acceptable, but you need to let them know that at this moment, this is what we need to do.
Have you had any challenges as regards that?
Yes, of course. Of course, people will want to rebel or revolt against it and say, you know what, this is not in our culture. Cremation is not in our culture. But when you talk about incidental plan, of course, and that's why one of the reasons why we have achieved so much is we need a lot of political will, because you need to give some directive, you need to give veto in order to contain the disease. If you leave it, because there is need for compliance, so it comes at a higher level, and then you give a directive to them and say it's a policy of government.
Sure.
Like asking churches not to embark on night vigil gatherings at this moment. It's not something you just send your director and say, go do. It has to come from the top.
Because, the area of even President Obama in his speech this week also said, we are still understanding the virus.
Right.
All right? Talking about understanding the virus, if we don't understand the virus so well, making people understand can be difficult, and that's why sensitization is very important here. And the schools are resuming. How do you intend to manage that area? when the school resumes?
Okay. Interestingly, in Imo State, we do have what we call the School Health Services program. That's one of the programs that was introduced last year, first to the National Council of Health. It was discussed at that level, and it was adopted and accepted. And we're going to leverage on that program to be able to make sure that we can reach out to the folks of these students. We hope to put in IEC materials, that's information, education, and materials on Ebola virus disease, so that they can specifically receive them even before school resumes. But the thing is, talking about the resumption of schools, this was a policy statement made by the federal government, and the state is trying to also see how we can work with that policy statement, because we were looking forward to resuming schools sometime in October, but we recently had that that directive has been changed. But be that as it may, we will definitely continue this massive sensitization that we've been doing already, and we hope that we can put in those kinds of materials back to parents, especially through what
and for kids, for children.
No, we're going to put flyers, things like flyers, to reach parents before school resumes. We have active parents teachers associations as well in Imo State.
Okay, so you're putting the responsibility of this spread during resumption on the guardians, on the teachers, and not on the children.
We hope that they become an extra resource. It can't be the children, it has to be the parents who can help as well to make sure that at least the kids observe those personal hygiene that is necessary before they get into contacts in schools.
What about the public health officers in your state? How well have you been able to help them in getting facilities in properly educating the people against the EVD?
Right, so we have a very well designed public health system in Imo State. What that brings is that we're able to make contact with all our primary healthcare officers as well, and right from the state, we're able to pass information down to the coordinators of heads of departments of health at the different local governments. So at that level, they meet, they're able to share information, and with that, we're able to pass down information to them. But before this happens, we've already called them into the state, and we've been able to train them and tell them a lot more about Ebola viruses so that they can understand it. So they're also part of necessary feedback that comes back to us at the state. We do have what you call the Community Government Council in Imo State, and that helps us to be able to get information real time right from the communities, because every community has a king or an eze, and they also have youth leaders and women leaders, and these people are able to get information right at the grassroots. And of course, the first point of call usually is the primary health care, or the community or comprehensive health center in the state. But with the provision of the Ebola helplines that we have provided, they are now able to reach us directly, so that